Dr. Karen Cerullia is a member and director of the Biobehavioral Sciences at Fred Hutch and professor at the University of Washington School of Medicine, Department of Psychiatry and Behavioral Sciences.
What we've learned in our research about exercise, both during treatment and beyond treatment, is that if people can keep exercising, it is going to be the one thing that is most effective at speeding their recovery. If we can retain their muscle mass and keep their energy going with walking and other kinds of activity during treatment, they recover faster. And then when they get out, if we can help people to get moving, we see that it's improving their mood, it's improving not just their energy, but also relieves pain, improves sleep. So it really has a lot of different effects, and we are beginning to understand that it is even improving not only quality of life, but actual medical outcomes.
At Seattle Cancer Care Alliance, we have a dedicated physical therapy clinic for our patients. The clinic is located on the 4th floor, a few steps away from the elevator bay. All of our therapists have advanced training in oncology care and help people of all ages and diagnoses. Sarah is a breast cancer survivor who received treatment at Seattle Cancer Care Alliance. Sarah's care team recommended physical therapy after her lymph node surgery.
Rachel Douglas is my physical therapist, and she explained the process. She did the baseline measurements in terms of range of motion as well as my arm measurements, and then introduced some exercises, as well as explaining to me what would happen with the lymphedema, what causes it, and how to deal with swelling, and all the logistics involved with ordering sleeves and the gloves and helping me with insurance coverage. So every step of the way, she helped me get going.
Sarah has been cancer-free for over a year and enjoys walking around Green Lake with a friend to get her daily exercise. Robert is a patient at Seattle Cancer Care Alliance. He sought out physical therapy hoping to build strength after having symptoms of fatigue and muscle stiffness during his treatment.
Lots of services are offered up: nutrition, physical therapy. I mean, there's lots of things that are available to you if you choose to use them. And I had said, I'd like to be talking to somebody on the physical therapy side. We started real simple, real light to begin with. The bands, stretching, pulls, things like that, and then stepped up. The colors of the bands, they get stronger, and again, sort of working on posture and core training. Over time, my strength was sort of starting to build back up. I was getting back to walking pretty regularly, spring into summer, and was walking a couple miles a day out there during that while I was getting my treatments. Hannah had something in mind. I want you to try this week, and she would send me a link, which was helpful.
My name is Hannah Gaba, and I'm a physical therapist and a certified lymphedema therapist, and I've worked at Seattle Cancer Care Alliance for about 6 years. Together, we came up with exercises that seemed to help, and of course, I had to look at his, doing a physical assessment, see where his strength level was, looked at his posture, and then came up with an individualized exercise program for him that would really help to strengthen where he needed it, improve his posture, which hopefully would improve his bone strength, decrease his fracture risk, and then also just making sure that he was on a good exercise program just for general mobility and well-being.
Our physical therapy clinic offers patients a variety of services. These services include manual therapy, strength training, gait and balance training, lymphedema education and treatment, endurance training, and an exercise program centered around your individual needs. To schedule a physical therapy appointment, Seattle Cancer Care Alliance patients need to be referred by their SCCA physician, physician's assistant, or nurse practitioner. The physical therapy department is open Monday through Friday, 8 a.m. to 12 p.m. and 1 p.m. until 5 p.m. To speak to a physical therapy coordinator, please call 206-606-6373.